That's good. Oh, finally.
All right, so taking a look at your posture first. Yeah, you can let that go here. I can already see where the curvature is here in your spine, just by the shoulder, the high left shoulder. And then there's just a little bit of that accentuation. So the apex and the convexity is out on the left here. And you said there was a kyphosis too. But let's just see right from there. Go ahead and close your eyes. See if there's any instability here or if it's mostly fixation. So mostly front to back rocking there. I don't see a whole lot of side. A little bit of a circular back to the left. Okay, that's good. You can open your eyes. So it's just front to back. And so the front to back means there's a fixation, not an instability. So it's much better, much easier to help.
Yes.
That's good. All right, now go like this. Go ahead and march in place, please. Just like march. Good. Okay. All right. No pronations or supinations, eversions or inversions of the feet. That's good. Nice and straight up and down from the knee to the ankle. So no genu varum, no genu valgum. Good, you can stop right there. All right, go ahead and turn around and face the other way, please.
Yep.
Yep, so there is a kyphosis here. Let's do this here. We're going to put my hands on top of the hips. Let the hips relax, let your arms relax. Good, we got the high left hip here. Looking at the glute folds, you're going to feel my fingers on the back of my hamstrings, okay?
Yep.
Good, glute folds. We're going to trace down over the pants. We're lower on the right side, with hypertonicity on the left. So possible AS, anterior superior rotation right there. Good, and this feels good down the side of the leg. No trigger points here, just a little bit of hypertonicity on this right IT band here. Left side, definitely have hypertonicity on the left glute here. Good, okay, looking from the top. No rotations, that's good, looks pretty even. All right, let's go like this, turn that way. Got it, we're gonna say you have a question. Here, turn your feet too.
Ah, okay.
Good, and then go like this. Good, and then go like this, like slouch your back. Good. And then stand up nice and straight. Good, okay, so we have good mobility here. Was that a crack back here?
It always does it when I'm doing it like this.
Gotcha. That's just your shoulder blade rubbing on the back of the rib cage there.
Okay.
Okay. Yeah, that's kind of a normal thing with a kyphosis. But this is, this is mild to moderate. It's not too bad of a kyphosis here.
Good. I mean, I'm working with it since a couple of years, like I said.
Good. Yeah, I have some posture straps here that I can give you that just kind of like, they give you this right here, that support.
Yeah.
And
if you want to teach English in Germany, you need 90 days abroad in an English-speaking country. And when I found out that my university has this partner program with Kutztown, and then I saw that you're not that far away, it's like 70 miles. I was like, okie dokie.
Awesome, man. That's cool. Thanks. Good story. Best thing I heard all day. All right, now a little bit of moistness at the bottom of the spine here. So that tells us that the parasympathetic nervous system is changed, versus up here. It's nice and dry, but as soon as we get to this curvature, it accentuates. It's probably generating more heat, and because of the curvature, it's like enclosed more. And so changes in the musculature from left to right are minimal. And it does get considerably warmer just right here in the thoracic lumbar transition. Over top of the sacrum is okay. This feels okay. But then again over on the left sacrum over here. Is this tender?
This is like the spot I was talking about. Maybe a little bit more to the left, but this is the spot that I always,
Right on top of the SI joint here, or excuse me, the PSIS. Right there, so it's right over top of the ilium. Lots of muscles connect there. This is we had a hypertonic glute on this side too, so we're gonna have to do some muscle work over there. What's this one feel like over here? Nothing, right? Good. So it is warm and moist over here, and that pointed us directly to that left SI joint. So that validates that skin. We talk skin temperature and also skin moisture level. All right. Okay, bring your chin down to your chest. Good, back up. Bring your chin that way, good. Which side feels more restricted to you? Left? Right? Or same. It could be the same.
Yeah, I think it's the same.
Okay, good. Tender, right? Right? Good. Breathe into it. Good, Christopher. Yeah, okay.
Oh, damn. Oh. I've been a couple of times to for a Thai massage because my girlfriend is tired of pressing my back.
All right, so let's try to get rid of some of that stress. We're going to start like this. We're going to start right here, right on the top of the kyphosis. We're going to follow that down. Give a little push like that. Good, it's already cracking. Let's do that again. Deep breath. Good, and out. Good. Nice. Good. We're going to come up 2 segments here. Good. Just checking. Good. 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 Left or right? Which is more tender here?
I'd say left.
All right. Let's bring your head over just a little to the side like that. A little push. Let the shoulder go. Let the head relax. Good. Good. One more, Christopher. Let the head relax there. It's okay. One to the right. Let's go. Good. Alrighty, deep breath in. Good. And out. Oh, not quite. Let's do it again. Deep breath. Good breathing. Good. Okay, not bad. That time was better. All right, let's do this. Go ahead and lift your right leg up in the air. Good, down. Okay, lift your left leg in the air. Down. More difficult over here on the left?
Mm-hmm. Yep.
Okay.
I'd say so. Yeah, it's a bit. Yeah.
All right, so this left hip is going forward. We need to correct that first. Lumbar spine is okay. That drop viper's okay. Let's see, are we tender here?
Not really.
Here?
No.
Here?
No.
Here?
Yeah, more than the right.
Okay, let's work out this one. Up here too, right?
Mm-hmm.
Okay. Nice, gentle breathing. Still tender here?
No, I think it's better.
How about up here? Is that one still tender?
A little bit. Oh.
Okay, just a little bit more forward there. Good. Yep, you can bring your head back just a little bit. Good. Good. Okay, nice and gentle, 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 gentle. Good. Sinking in. Good. Nice. Good. Very nice. Good.
No!
Oh my God.
Finally!
Lay me back. Oh, yes.
Oh. Oh, and it goes up like Jesus Christ. It's like
good. Breathing. That's excellent breathing. Good. Good, 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 good. Lay on your back. That's good. Yes. Nice and gentle breathing. I'm just going to follow the breath, just like the other adjustments. We're going to go in like this, push in that direction, right like that, right there. You're doing fantastic. Nice, gentle breathing. Good. Nice. All right, let's see what the left side has to say. Okay, I'm gonna test first. 7, 6, 5, 4. Good, right here. Good, yes, sir.
wow.
Nice. All right, bend both your knees. Good. Squeeze my fist here in between your knees. Hard as you can. Harder.
I can't.
All right, that's good. Okay, push here. Good. Push, 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 push. Relax. All right, hold your knees together now. Good. Hold them together. Good. Fingers up. Fingers up. Is your digestion the same here?
Yeah, pretty much.
Okay, good. So the food change didn't affect it too much?
No, I mean, yeah. It's just that I really do like to cook, and yeah, it's I can't do it here like I'm used to at home.
Right. Good. Let me see your arms here. We're in this little pull. One more time. Okay, that's good. You're in there. Nice gentle breathing. Just remember to keep your teeth together. Good. Good. We're going to follow the next breath out, Christopher. And then we'll give it a pull in this direction like that. Good.
It feels like everything is like flowing right now. I mean, even after the other adjustments, I have to digest all of it. It's like up and down and left and right. It's like oh yes. Was it like normal that I feel like everything is like circulating and flowing up and down? It's like
yeah, your face is really flowing. Lots of blood flow in your face.
Yeah, I can. Damn. Yeah. Now I can get going. Whew. Oh, I think I have to just. Great.
Good. Push. This one here, push. Good. Relax. It's okay. Bring your chin down to your chest. Good. Bring this guy up here like this. Good. All right, sir. Hold on. Okay, everything that I possibly could have cracked today, I cracked. Got that left hip going down here, most important. It's going to be a whole new world for you now.
Can't wait.
Yeah, you should be able to stretch it out and maybe get some clicks down there. I got this one here right underneath where the apex is. Big stuff. I could tell by the way that it clunked real loud that it doesn't move very often. And that one's really important for you too. You wrote your email address down, so in a couple of days you're going to start getting some emails. There's 3 automated emails that are going to come from my practice. The second one, it has a bunch of links to some yoga videos that I made. And it's the best stretching that I can possibly recommend.
Okay.
And so just watch those videos like with the intention to like learn the routine. It's a very simple routine. If you learn how to do it, you can just do it one time for 5 minutes, or you can do it twice, or slow it down. You could do it for an hour if you wanted to. But even just like 10 to 15 minutes of that routine every day, it'll make all the difference in the world. It'll make you have much less pain. You don't have to see me or any other doctor, much less.
All right.
And there's some meditation in there too for you as well. Sounds like you've got your stuff together nutritionally, which is good. That makes all the difference.
I'm trying. My girlfriend helps.
That's good, yeah.
She wants me to get a bit more meat off. I mean, I think I don't eat that much meat.
What's your blood type?
Oh.
Find out what your blood type is. Listen, you have to listen to what your body wants, not what your girlfriend wants. Unfortunately, women are very intuitive, but also you have to listen to your body.
I told her too, because I mean, sometimes I have a craving for carrots and cauliflower, for example, and then I eat like, I don't know, a pound of it, or, you know, and sometimes it's not that I eat, I usually eat, or I like to eat fat stuff, so, I don't know, but I think I have like a feeling for it, because my body tells me like what I need.
Yes, listen to your body. You're doing a great job so far keeping yourself in check. I'm going to show you what these posture braces look like, okay?
Okay.
And if you, I'm just going to give you one for a gift, and I want you to try it out.
Thank you.
And if it's good, if it works for you, that's good. And if not, that's okay too. Really, it's all about the stretching.
Good. So it's not that you say like get some I don't know, weightlifting and muscles, or I don't know, stretching. Good, because I was with one orthopedic. He also did an X-ray on my spine, and he said like the what's the English word? Vertebrae?
Yes.
Is that a word? Yeah. He said that my vertebrae are not like rectangle shaped. Sorry.
Oh, it's okay.
He said they're like more like a
wedge.
Like a wedge, and this is why I have in Germany there's this term called Scheuermann.
Oh, Scheuermann's.
Yeah. And he said this is why I have the curvature, because the wedges, when you stack the wedges,
correct,
you get this, and he said you have to do like muscles that pull all of that stuff back, and a lot of rowing and blah 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 blah.
That's good. Yeah.
But yeah, I don't know. I like more stretching, or like riding a bicycle, or going for a walk, or stuff like this. So
cool. You're doing a great job. Keep doing what you're doing. You know what you're doing for sure. I mean, you're a 38-year-old man, right?
38.
Yeah, you should know by now anyway. All right. Is there anything else that you want me to work on? You have any other questions or anything?
If you say I'm good to go and that it looks good, then I'm really, really happy. It's really good news for me. I will keep doing what I'm doing, and I'm good to go.
Cool, man.
Awesome. Thank you very, very much. It was really a pleasure to meet you finally.